Thanks, Lisa. So my name is Breanna Gibbon, and I work at CHEO for the Navigator program, and it's offered in partnership with Pinecrest Queensway Community Health Centre. And Teresa is my colleague, if you want to introduce yourself.
Sure. Hi there. I'm Teresa MacMillan, and I'm called the Parent Navigator with the Navigator program. And I work out of the Pinecrest Queensway Community Health Centre, and I offer peer-to-peer support for our parents. And that's my role.
Wonderful.
Perfect. Yeah, so I can just jump right into it.
Sure.
If there are any questions, just let me know. I know the last time we did this, there was a bunch at the end, but please feel free to jump in. So today I'm just hoping to provide an overview on the background of the program and how it came to be, what the goals are, a bit about the model and where we are. We've been operating for a year now, so a bit about the criteria on who we support and what some of those trends are, and what some of the things we're hearing from the families that we're supporting. So the program really grew organically from parents. So CHEO has the Champlain Complex Care Program, and in working with families to support them, a program in supporting the medical care coordination of the child, families were articulating in their parent or in caregiver role that they are experiencing social isolation, mental health issues as a result, burnout, loss of employment, and financial stress. And also as well that, not feeling recognized or supported as a caregiver or as an expert, on their child as part of the team. So really having somebody, be that voice for them. So it's just a small sample from the complex care population. So as you can see, the numbers are only 30 respondents, but this was it was just a piece of information used to articulate the need for the program. So as you can see, there's employment on the left. So 81% of the fathers are employed, but if you look at the mothers, it's a much lower number, so almost half are unemployed. And then if you look at the actual income,
Yeah.
Hello? Oh,
yeah. Okay. Unless you have the package, so it's the.
I can hear somebody chatting.
Oh.
There we go. Okay. And then the other one is the annual household income before taxes. So if you look at it, it's a pretty significant chunk that is under, first of all, under 50,000, but then also under 75,000. So, all right. So coupled with that information that we had from the complex care program here, also looking at the literature, the total economic cost of families with children with disabilities range from 20,000 to 60,000 per year with an average of 30,000. And interestingly enough, we've just finished our first year of the program, and some of the families, when we were looking at some of the social demographic information, echoed that 30,000 was approximately what the out-of-pocket cost was, so what was not covered in terms of medical care, equipment, etc., for caring for their child. So parents of children with medical complexities experience negative impact on economic, psychosocial, and social well-being. And that the health systems that are in place are often not able to provide resources to these families. So new models of care are required to address this for this specific population. So the Navigator program is funded through Employment and Social Development Canada. So we received 5-year funding, and its intent was to address this critical gap in support for parents of children with medical complexity. So it provides a dedicated expert resources to really minimize the social, emotional, and economic impacts of caring for a child. So twofold to that, it also aims to uncover gaps in the system and identify solutions to issues that families most commonly face. So, and this is with intent to increase community capacity, the ability to support families and to raise awareness. So really, while we are supporting families individually, we also very much have a strategy that focuses on system level improvement for these families. So our work is twofold. So the goals are to promote the social and emotional health of families, to help families access and navigate key supports and services, and again, the second piece of increasing understanding of best ways to support families, finding what the gaps in the systems are, and trying to find solutions to the common issues that families face. So our vision is every family, with a medically complex child will have access to services, supports, and information to help them thrive. So how do we do that? So I'll let Teresa speak a little bit about the parent navigator role because it is a unique one. So Teresa, if you want to.
Sure. So our role as the parent navigator, we offer peer-to-peer support. So we offer the fact that I know what it's like. I have my own medically fragile daughter. She's 16, so I've been around for a while, and I think I'm savvy in some aspects, but there's still so much information out there, and every parent offers so much. We learn so much on our journey that it's important that we all get chances to share it. And so my job is we do monthly sip and chats. So it's a time where parents and caregivers can come out and, we'll have workshops on specific topics, or else we'll just have a time where parents can come and chat. And we just sit and talk and, whatever evolves out of the conversation. Sometimes it's a rant, sometimes it's a cry, sometimes it's just a lot of laughs. And because it's just a chance for everybody to come together and be supported by someone who gets it, by someone who knows what it's like to be exhausted and to feel isolated and to go through the system, and sometimes you don't know where to turn. You feel like you've exhausted all different avenues and you're just not sure what to do, and sometimes someone else can offer some, a different outlook or a solution maybe. So we offer those opportunities. We've done a Family Fun Day last year. That was so much fun. We had the families come out, we had entertainers, we had free prizes for the families, we had a photo booth, and face painting and crafts. It was just such a really nice time for families to come out and, to come with their children and to meet other families and just to kind of connect. So that's what we're all about. We're trying to make connections. Not just to other families, but also to the parent navigators, because it's a lonely road, it's a lonely journey. So I visited families in the hospital. We go out into the community. I just had a lovely lunch with a mom last week, and by the end of the lunch we were both hugging and had tears, because it's just so nice just to talk to someone who really just does understand it. And sometimes that's all you need to. You just need to connect with somebody who does get it. What else have we done?
We just had a question pop up, and I know, sorry for interrupting you, but because
that's okay. I didn't see it.
Teresa's calling in, she graciously is calling in from home on March break. So it is a paid position. So there are two parent navigators as part of the team, and they're both a 0.6 FTE, but they are paid positions. Yes.
Yes.
Yeah. Sorry for interrupting.
That's okay. And I think this position being part-time, it works so well for me as being a mom, because it affords me the opportunity that I can still take my daughter to all of her appointments and when she's sick and whatnot.
Yeah.
I think
also, if I can add, most recently,
yes.
Next week we're starting, there was a request from families and as well as from the Champlain Complex Care program to have the Navigator program be present during clinic. So clinic is Tuesday, Thursday, and Friday. So we decided to start with one day. So and we, as a program, I mean by the peer support. So Teresa and her colleague will be present, just in a room off to the side in case there are anything that parents need. If, the complex care program can direct families, if there is anything that, they feel appropriate. So families will be made aware that we're there when they come and check in for their visit, and just having that friendly face there for them. So I'm going to move on. So system navigators, so as I said, we have 2 parent navigators, both 0.6 FTE, and then we also have 2 system navigators who are more resource focused in terms of navigating the web of resources. So we work with families on a strength basis, so families, for example, when we meet with them, they identify what their goals are, what their needs are, and the range of support is from social to emotional support. So, some examples are, the siblings needing support in terms of any mental health issues that may be arising, or engaging in pro-social activities or finding pro-social activities, advocating on behalf of families when they just don't meet that specific criteria. For example, the City of Ottawa, in terms of receiving financial support for recreation, there's an income cutoff level, but most of our families don't, although on paper they make a lot of money, that money is going elsewhere, and so, the disposable income isn't there, so advocating on behalf of them in terms of in terms of being recognized, and housing adaptability, in social housing. The list just goes on and on, but I like to provide some examples. But so that's what makes up. So there's 2 parent navigators, 2 system navigators, and then the third piece, again, that's the support, but the knowledge navigation. So while we're supporting families, really gathering information, to inform what some tools and strategies are to support them. So learning from where the gaps are in support, so that we can improve everybody's collective understanding of the parent's lived experience, find solutions, and build community capacity around there. And ultimately, a deliverable is to establish some best practice guidelines, and share our knowledge with others. So this is our program model. It was drafted with our team and the parent navigators with input. And our program started from parents wanting the program and their desired, articulating the need for support, and they remain really involved in helping shape the program, and still do to this date. So multiple consultations, in terms of how not just the model, but what the actual support looks like, etc. So it was funny, we had a session and invited families, and the model that we had, they had a giant Sharpie and just scratched it out. This doesn't look like what we don't relate to that. So in the middle is the family. So we hear often there's, child-centered care, family-centered care, and, to differentiate between the caregiver, the child, etc. It's really, we're supporting the caregiver holistically as a family. So some of the things that, the yellow bubbles are some of the things that we assist with and can assist with, and the little people are their community, because, we hear so often from families, the hospital is our community. Like, this is, when that's where the families are spending most of the time, the hospital becomes your community, and this becomes the reality. So the green bubbles are some of the ways that we're providing support in those areas, and then there's our 3 pillars: system navigator, knowledge navigation, and parent navigator. So we've just, you've heard me speak about, we've just completed year 1 of the program, and so year 1 was somewhat of a pilot, and a pilot in as much as we had 30 families who were referred to us from the Champlain Complex Care Program here at CHEO. So that was with intent, knowing that the child's medical care coordination well, medical care was being coordinated. So in terms of getting our feet on the ground and being able to really find the place where we fit in terms of not duplicating services, but ensuring that we're working, with existing services already, or supports within the hospital. So as you can imagine, there was some learnings that came. We also completed an evaluation, first-year evaluation, and have really, we've changed our path on a few things based on that. So I think I always like to share one of the best learnings for us was that in the beginning, there's a lot of research out there in terms of like the peer support component. There's a lot of research about Holland Bloor Review came out with their toolkit, or came out, and the suggestions there really was resoundingly, let it happen organically. You can't match according to diagnosis. You can't match, you don't know what stage of the journey people are at. And so what we had thought is that when we met a family, we met one system navigator, one parent navigator, so that the families they wouldn't have to repeat their story twice. They wouldn't have to, we were a unified team that could support on all aspects. And so our learnings were that that may not always be the best, that, having a family talk about some of the income challenges or marital challenges in front of a peer, it really reduces the capacity for the peer to just be a peer. So we heard that from families, but we also heard that from Teresa, from our parent navigators. So that was one of our learnings. So that no longer happens. So we have a centralized intake, and the families articulate what their needs are, what they're looking for. And if it's a peer, it just goes directly to the peer support, or they can come to Sip and Chat, or they can go to, Connect in MDU without having, the professionalizing, doing a formal intake. So I saw a question pop up, but I don't know where it went. Does somebody have a question?
There are a couple of questions here, so
yeah.
Let me just scroll down to it. I just lost it too.
Yeah.
Just a sec. So Heather's wondering what the professional background of the system navigators is there.
Yes. So one is a social worker, who's not me, and then myself. My background is in community health. And so doing health promotion for youth and families specifically. So, and then, my credentials or whatever is I have a master's in organizational leadership. Great. So I do a lot of the, the way our caseload is divided. I do a lot of the capturing systems level, informing best practice and working on that piece, whereas the social worker really focuses on providing psychosocial support, although I do system navigation stuff as well. So we really complement each other really well with the variety of backgrounds that we have. So
great. And are your positions full-time?
Yes, ours are full-time.
Okay, great.
Yeah.
Thank you.
Yeah, no problem. Anyway, so we are now in year 2. And so a change is year 1 we received referrals. Year 2, families can self-refer. So families and service providers, but we really wanted families to kind of own a piece of that process in terms of identifying what they need support in. So this, counter to some things where there's a consult or a prescription in terms of supporting families. It's a really shift in culture in terms of having the families meet us where they're ready. So in year 1, we actually had families that, some of the clinicians or CHEO staff thought that they could benefit from support, but the families said, no, thank you. Like, we're just not at a position, emotionally at this point in time, we're not at a position to talk to another person, to share our story again, to, and so we since have had families come back when they were ready and say, you called us 6 months ago, what is this about? But so year 2, again, that was another big shift as we've promoted the program in a way where parents are the, own own the process, set the goals, and we meet them wherever they are at that point in time. So we have the capacity of serving 150 families over the 5 years. We currently have supported 54 families to date. And so what that looks like is we're providing ongoing support to 32 families right now, and the other 22 have either achieved their goals or have been connected to another appropriate resource. So we don't decline service. Everybody's welcome. Yeah, I can share a bit more about that after in terms of, I think, there you go, eligibility criteria. I'm just going to read it. So the parent or caregiver, a medically complex or fragile child or teen under the age of 18 who is currently receiving services from CHEO. And so that took care of geographic. We thought about just in the Ottawa region, how far does it extend, etc. And so their child has to have one of the following. So multiple medical issues, that's a mistype, I'm sorry about that. They have to have both of the following. Multiple medical issues that may or may not have an overriding diagnosis and or multiple specialty teams involved in care. A chronic condition that requires ongoing, frequent, or time-consuming medical interventions, including 24-hour management of care. So that's the child piece of it. And then for the parent, we really wanted to spell out like what can this program do. So we clearly articulate, and again we worked with families on having this language reflect what they're experiencing. So seeking support in at least one of the following areas. So achieving employment or education goals, improving knowledge and access to key supports, expanding your social support network, strengthening relationship health, coping with stress, creating self-care techniques, finding accessible recreation, connecting to peer-to-peer support, and just managing the day-to-day issues. So the key elements of the program we really have, so that we do not decline service, and our philosophy behind is we will support anybody who contacts us, and that level of support is different for each family and should be fluid. So there's the one-on-one peer support, which Teresa spoke about, that can happen anywhere, right? It can happen in clinic, it can happen, visiting if your child is admitted, it could happen at the sip and chats, which is, a social gathering, one-on-one system navigation, parent therapeutic support groups or social worker is offering one of those, the social gatherings, workshops, and outreach and community education. So for the workshops, that was a learning for us as well. Some of the families declined service because they felt that in the first year when we received referrals, they felt that they were in a position where they were stable as a family but would like to give back. So the amount of families that were wanting to contribute back into this community of support by way of sharing what knowledge they had gathered. So that is really rich. So we're working on supporting families that way. Okay. Teresa, do you have anything? I know I'm talking a lot, but is there anything that you want to add before I go into some of the gaps?
Well, maybe I'll just touch on that we've had a few parents do workshops for us.
Sure.
We've had a mom come in. She had redone her whole house. She was an occupational therapist, and she had she actually had her house built for her daughter's specific needs in mind. So we had quite a few parents come out to that and ask a lot of questions about how they can, best go about doing it and what financial supports there are through the government and different programs to help finance those costs. We had another mom who she was doing some financial advising and just talking to our parents about some disability credits and that sort of thing. So, and I'm always getting emails from, just had 2 this week from parents who want to volunteer or have some great ideas they wanted to do. One mom wanted to do a paint night but she wants to come to it, but she didn't want to organize it because it's too much work for her. So we've done that, and we're hosting that at the end of April, a paint night for parents to come out. And she had another idea of doing a tea party, so we're having one of those, and we're just getting lots of parents who want to volunteer and who have great ideas. They just don't have the time and the energy to put them into place, and that's where we come. That's where we come in, and we're starting to see those sorts of things, and it's really lovely to see.
Yes.
That's all I had.
Okay, so gaps and barriers. So this is part of the, part of my role in terms of collecting some, what are we seeing? What are the trends? What are the issues that we're addressing? What are some of the challenges? So I don't think any of this would be a surprise. It never is whenever I share it. And so this slide was actually, we've since done done some of our evaluation framework and collected a little bit more data on this, but really the top 5 or 6, financial burden and navigating financial assistance is the top and still is. Isolation and social network, that is still, if I look at the stats in the last quarter, we collect data in terms of what social determinant of health we are supporting the families with in terms of system navigation, not the peer support, but system. And so financial was 40%. 40% of the families were requesting support with financial. The other was social network at 19%. At 9.5% was early childhood development. And that was typically for siblings. And then at 5% was housing and education. So, and I missed one, I'm sorry about that, but at 8.5% was physical health of the caregiver themselves, so whether it was mental or physical health. So that's some of the work that we're doing and some of the gaps that we're seeing. So there will be more to come on that as we continue to support families. So some highlights to date. So I mentioned we supported 54 families. We have our year 1 evaluation complete, and it was quite, we had a really high response rate. So we had 60% response rate. And so 85% of respondents agreed or strongly agree that through the support of the program, they have an increased knowledge and access to key services and resources. And the other is 92% agree or strongly agree that they receive support in connecting to those key support services and resources. Social work community of practice. So here at the Children's Treatment Center, there's the merge now, but it's still separate in terms of there are social workers at OCTC, social workers at CHEO, at various organizations supporting the same families, but just under different mandates and in different capacities. So we've created the social work community of practice so that we can work together to try and address some of the common issues that we're seeing. So we're still at the beginning stages in terms of just having a common understanding of what each other does and the role, and so that we can collectively support families. Post-traumatic stress disorder training, we hosted that last quarter and brought together some of the complex care nurses, all of the social workers, and it was the Crisis and Trauma Institute that came in and delivered this, and really, brought to light what some of the trauma that families encounter when you have, a medically complex child who's chronically hospitalized, ill. So as a result, we are hosting a therapeutic support group on trauma that starts in May. So it's our team social worker and the OCTC, the Children's Treatment Center social worker, will be jointly hosting this. The other thing is the database that's hosted on the Knowledge Exchange Network. And so we are on there. It's a local database of resources for families. We'll be having a soft launch. I believe it's up now, but a soft launch at the end of the month, and families have the ability to contribute their own resources as well as families find. So really a living, breathing database. And then also at the end, you know, I speak about best practice, and that's where that will be housed. So the resources are local, but the learnings and the best practice and that will all be available on the Ken for people. Whoopsies. I think that, can I go backwards? Sorry about that. Yeah, and then the other is we have a creative writer who is writing some gentle advocacy pieces on challenges or issues that families, you know, as they come across. So one was actually on the trauma, and the most recent one that is coming out is on some of the financial burden. So, so these are actual live links if anybody wants to click on it. And that's it. And I think, Teresa, do you have anything? I know you just shared some lovely final words last time we did this, and sorry to put you on the spot.
I think just for me, I think that's okay. I don't mind. It's such a great program because I've kind of been doing it on my own all these years, and I know what a difficult journey this is and how isolating and how frightening it is. And so for me to be in this position, it means a lot to me because I met a parent a couple weeks ago, and when she told me something about her son, I said, oh yeah, my daughter has that too. And her son was much younger, and I could just see in her face, she just looked so relieved, and I think that's why I like doing this job, and I love this program, just because you don't feel alone anymore, and it's really nice to connect to those families and just to give them a little bit of comfort and just to know that they're not alone, and you can get through it.
Great.
That's it.
Thank you. There was another question that popped up too. So the Knowledge Navigator isn't at a clinic level. So the Knowledge Navigator they're actually employed through the Research Institute here at CHEO. So I don't know if that answers your question. I think the other, and I didn't mention it in the slides, but we've worked really hard to provide holistic support, especially with the complex care. So not all of our families come from the Champlain Complex Care Program, but some do. And for those that do, I mean, it's a large majority of families are, but we've formalized collaborative efforts. So we attend weekly rounds and jointly discuss families that are in both of our programs, and yeah, just to, you know, to kind of formalize our efforts to support families. So I'm open to questions.
Great. Thank you very much, Breanna and Teresa. Lisa, as we've done before, if you wouldn't mind just running through the list and quickly asking if there's any outstanding questions, that might be an easy way to go through it. And
the other is I'm open for questions after, if anybody wants to email or would like more information.
Great.
And if we could just limit the round to just questions. I know everybody's probably thinking exactly what I'm thinking as well, which is, wow, this is just fabulous, and it's so great to hear that somebody's ideas and somebody's work has kind of, you know, resulted in a job also, as well as,
yes,
outreach to so many more people in a way. So
thank you. Yes.
All right, I'll just start at the top of the list there. Bianca, any questions? Or
I don't have any questions, but just wanted to echo what Chris is saying, that it's such a great presentation, such a fabulous project, and thank you so much for sharing.
And
thank you.
Brooke?
No questions for me. Fantastic work, though.
Dania? Deb? Deb?
No questions for me.
Okay. Delapo?
no other questions from me. Thanks.
Gail?
Just a fabulous program. I guess I'm always concerned about pilots and not really having the money sustainable, but hopefully with your evaluation, you will see that this is an essential service.
Yes. Well, and that's the, we always operate not wanting to create an expectation that if the program is gone, that there will just be a gap left, right? So we're working within existing supports in the hospital. So a lot of it is redirecting or facilitating conversations, or, you know, and that third piece, so yes, we're serving families, but that third piece in terms of sustainability is really that knowledge, like, you know, so what are the challenges, what do families need, what is missing, and to, you know, to inform best practice around supporting. And so that, you know, all of those learnings around the model development, around, you know, what has worked and what some of the needs are, that will all live on the CHEN eventually, so that, you know, some of these learnings can be shared. So in the event that the program, you know, whatever happens in terms of funding, there will still be a longevity or a piece that is sustainable, or recommendations that will live with CHEO, or, you know, it may not be the program itself that takes it on, but, you know, partners or etc.
Great. Geraldine?
Oh, hi. Thanks for the presentation. I echo everybody else's comments, and I don't have any questions right now.
Great. Thanks, Geraldine. Heather?
Hi, again, a great presentation. You know, I'm always interested in knowing if there's been any connection between sort of supporting families, and I'm expecting a lot of families are concerned about that upcoming transition when children were transitioned into the adult care world. Has that been something that, you know, you're specifically focusing on?
So we have done some work around supporting families in terms of transition. So CHEO has the toolkit and does some work in terms of preparing families for transitioning, but a lot of the work we do or have done is in terms of connecting the parents are sharing information on ODSP and on DSO, how to connect, what can they offer, and in terms of that, you know, the actual, in terms of the child transitioning into the adult medical world, that is CHEO's team that does that. But this is, you know, around some of the social programs, around the finances, around what that will look like. We often, you know, I know I've personally attended two transition team meetings since in this role. So yeah, I would say it's not huge, but I would say there's probably been at least 5 families that we've worked with in some capacity around transition.
Thank you.
Yeah, before I go on to the next one, this is Lisa, I just have a comment too, but I think that this sort of program might empower families a bit and make them more confident to look for that information, or give them some more skills to find what they're looking for. I mean, I might just be making a big assumption, but...
No, you're not. You've heard the presentation twice now, and yes, you got it. You've got it.
Yes, so I think that helps in the, you know, in the future. This is where I was seeing it, you know, in terms of transition, is that sort of empowerment of families and that confidence and capacity building. So that's what I see. So,
yeah.
Thanks. So, John, do you have any questions?
Just a comment. I think it's great that you guys are valuing having parents involved with your program. The question I have is, has the topic of mental health supports for parents ever come up within the parent group? So I guess it's, I think it was Teresa who was speaking. From a parent perspective, because I'm finding a lot of moms, as their kids get older and go into adulthood, they're just not having that support. So they're very isolated at home, but it's very difficult to identify when their kids are extremely medically complex, because they have to be by their side a lot of the time. Reaching out to people by email or social media, that would be another area I'd like you to comment on, if you could. parents are reaching out through that area as well?
Well, we always open our sip and chats. We always provide Zoom. So if parents are isolated and they can't get out, they can connect with us through that. Yeah, I think as the children get older and they start to transition, like I said, my daughter is 16. I'm finding myself being in this position and having to think about that, and it's a whole other world. And so there are a few parents that I've connected with who, you know, we sit there and we talk it out ourselves, because it's a whole other being when your child is being transitioned, and how that works and how that relates for us. And I mean, for my daughter, hopefully she'll be able to be somewhat independent, but for some families, these children won't be independent. So it's a really big conversation, and I think that's where our social worker will come into play as well.
Mm-hmm. I think that we've tried to have as many entry points into the program for families, depending on where they are, but we also try and remain as fluid as possible. So if a mom or someone comes into the sip and chat and there are some mental health needs that need to be addressed, or need to, that they would like supports with, or even that Teresa would recognize that there needs to be support, then it would be a referral, or it would be are you aware that we have a social worker that can come and meet you in your home, in the community, and so we're very, as a team, fluid in that way. But 100% mental health is a very, it may not be the number. As I said, we meet parents where they are, so it's not, we see that there are some mental health challenges, or that there are some mental health issues. It's, if the parents recognizes and is asking for support and seeking support, then the social worker definitely works with the families. But oftentimes it's very task specific, or very, in terms of what their goals are, but through we strategically connect our social worker with specific families, I guess, is the long short. And then the other, in terms of social media, so we do offer, as Teresa said, Zoom. It hasn't been very, families haven't really taken us up on it, or it hasn't been used. We wanted to make ourselves accessible that way, and it just hasn't been. And then the other, social media is huge, and so CHEO has one Facebook page, and no other departments have Facebook pages. So we are working really hard to be able to for our team to have a page for families, so that they can connect via social media. But we're not there yet.
Oh, what is Zoom? I may have missed that.
Zoom is just a platform, an IT platform, where it's like Skype.
Oh, okay.
Yeah, so families, we offer that families can call in, can Skype in, it's just Zoom is the platform that we use here at CHEO, and so, yeah, and so they haven't.
And do you guys continue on after the age of 18, 19, 20?
So we do not. So part of the eligibility criteria is your child has to be, let me pull it up here. Am I screen sharing it? How was the wording? It was specific wording, but no, your child has to be under the age of 18.
So who would take over after the age of 18, 19, 20?
So it would depend on what the family's needs are. So we have worked with families where the child has transitioned, and so we have connected to DSO, the financial aspect through ODSP, but then also depending on where they are and what the unique needs of the family, there are also the community-based resources, right? So our program is offered in partnership with the Community Health Center, and we're well tapped into those, that network and any other, social supports in the community. So.
Well, I think it's a great.
Oh, sorry, go ahead. I was just going to say there isn't an equivalent of us for adults for in the adult world.
Yeah, no, I think it's a great program, and I also look forward to like years 3 and 4 and 5, because I think you'll have great outcomes.
Yeah. Well, and that's thank you. That's that's the hope.
Alrighty, thanks, John. Karen Johnston?
Basically, I just want to crawl inside your head and figure everything out, but did you come up with job posting and training and all that sort of thing? We're sort of in the initial stages of developing that.
Yes. So you will see, we actually have one of our parent navigators. She has young kids, and she's a nurse by trade or by profession, and started back at work with the Navigator program, and she now is accepting a full-time nursing position. So we have a vacancy on the team, so we have a posting, and it looks completely different than year one. So year one and year two, there have been lots of learnings, and so that posting is up on Charity Village here, but I can also share that. And what was the second part of that question?
Coming up with training, like, I don't know if you're doing like health beliefs or like the heads assessment, or exactly how you've broken down your training for stuff.
Yeah.
So that might be too much, but I would love to talk to you.
Sure, we can connect offline, because we, yes, we did quite a bit of training in the first year. So we can.
What's the best way to reach you?
By email. I think my contact information is on the end of this PowerPoint if that's shared, or if Lisa, if you want to share.
Sure, I can share out following the call.
You can do that to the group if you want, and then if there are any questions.
Yeah, I think you've done fabulous. Like, it's very exciting, this presentation.
Thank you. We've worked hard as a team, and the big part of the team is the parents. Like, they've informed us every step of the way. They've come, despite what's going on in their life, they come and take 2-3 hours to come and tell it like it is, what would be most meaningful, right from the language that we're using, right from how we're promoting the program to, to everything. To, their voice is the one that we're now in clinic in MDU, because they wanted presence there. So, trying to be responsive to that, and, we have a certain flexibility with the program. There's some deliverables, hard deliverables, but to remain flexible so that it is meaningful for the families we're supporting.
So just a couple more people. We'll try to get through the last few questions quickly. So Caitlin? Oh, I'm not hearing you, Caitlin. Alrighty, so Susan?
Thank you very much. It was really wonderful to hear about this program and see the description. A question that I sent online as well is to see what was asked in the evaluation form, to see how successful the program. You mentioned that access services and so on, but what other components ask about in that evaluation? What were the?
I think I got that. Your phone, you were cutting in and out a little bit. So in terms of our evaluation framework and what we're measuring, I mean, it's really comprehensive. So I can give you some high level, but we're obviously the basic encounters, what type of encounters that we're supporting with, what the social determinants of health, and then in terms of, we use My Outcomes. Oh, similar peer navigator program here. Yeah, okay. So we use My Outcomes, which is an outcome rating scale and a session rating scale to measure impact and change with families. So they are the ones who are rating themselves and how each interaction and how things are progressing. And there's a variety of tools that we're using to capture. But I'd be happy to chat with you a little bit further, because we had a hard time, because as you can imagine, CHEO, and we're charting an EPIC, we can't really pull data out of the child's chart, and in terms of having something comprehensive to collect data and measure, we've had to be really creative. So I'd be happy to connect with you sidebar and explain that.
Okay, thank you very much. We will contact you.
Yeah.
Alrighty, and Yanni.
Well, hi there. Thank you very much for your presentation. I know we're short on time.
Okay.
I'm from the Center for Addiction and Mental Health in Toronto. And I just wanted to build on John's comment on the mental health of the family caregivers. And I know you had the PTSD training, which is fantastic.
Yes.
I just connect to a small study a group has done here, and I stress small, where they trained parent caregivers not only in peer support but also in mindfulness and acceptance and commitment therapy. And
Okay.
they compared a group of parents who are waiting, parents of young people with autism spectrum disorder who are all waiting for services. So they did the ACT mindfulness group and an information only sort of system navigation group. And it was interesting, in the small study they showed that there was a significant decrease in stress, depression, anxiety in the parent group who had the ACT mindfulness that was sustained compared to the parents who were just getting traditional peer support and information. So it might be something interesting to think about on our side too, like combining peer support, actual interventions for mental health, and information system navigation could be promising, because since the stress, we all know the stress anxiety that's reported by parents, but maybe we're not necessarily addressing the anxiety, stress, depression, etc.
Yeah, I think that would be great. And, you know, the peer component is ever evolving and changing and shaping in terms of what, and, you know, with just 2 at a 0.6, you know, I don't think that we can support everybody, you know, to the extent that would be ideal. And so we're looking at other options in terms of, you know, other hospitals have, I think it's London has that volunteer, it's a parent-led volunteer organization of support for families. So it is peers that are, so we're constantly trying to inform what we're doing in terms of the peer support. Like what's happening now is wonderful, but I would be interested in connecting with you about that study.
I can see what information I can share. Thank you very much for your presentation.
Thanks, Yanni. That was helpful.
Great. Alrighty. And Caitlin just wanted to say her microphone's not working, but to remind people that they do have a similar peer navigator program at the Ability Hub in Calgary, and with the navigation and peer support. So.
Okay.
Yeah. So maybe you can compare notes.
Yes. Yeah. So if you could connect us all, that would be great.
I will do that.